Okay. So, hi everyone. Welcome to MedTalks, the podcast where we dive into the world of healthcare and bring you closer to experts who save lives every day. Today, we're incredibly excited to have Dr. Kesava Ananth, a pediatric intensive care unit consultant with over 20 years of experience in managing critically ill children. He's here to share his expertise in pediatric critical care, specifically around the most pressing challenges children face in intensive care and the innovation that are transforming outcomes. So, Dr. Kesava, do you want to give a brief introduction about yourself?
Thank you, Akshara, and thank you, Harini, for inviting me to be part of this conversation. I'm originally from India. I trained in India after training in pediatrics, basic training in pediatrics. I moved to UK, where I completed my higher specialty training. I trained there to be a pediatric intensivist. My motivation for becoming a pediatric intensivist um, uh, is I was very interested in providing post-operative care for children after cardiac surgery. When I was in medical school, I found that there were very few intensive care units which could provide that kind of service. So I went to UK to mainly get skills there about the pediatric cardiac critical care. However, after finishing my training, I continued to work there for a while, and I moved to UAE about 6, 7 years ago. I specialize in pediatric critical illness, and I am the lead for a unit taking care of critically ill children in a big hospital in Abu Dhabi.
Thank you so much for joining us today. And we'll dive into our first segment, which is talking about pediatric critical illnesses. So, Dr. Kesava, thank you for joining us again. This is a topic that's on everyone's mind. So, what are the most common critical illnesses children face in the PICU, and how do you manage them?
Yes, basically, infections are the most common cause for critical illness in children. The most common critical illness we see is respiratory failure from infections in the respiratory tract. We fairly often see, sepsis, which is like an infection, generalized response to infection in the body. And we also very often see neurological conditions, for example, prolonged refractory seizures or infection in the meninges or brain. We also take care of a lot of children who require complex surgery, like cardiac surgery for heart defects. Many children are born with congenital defect in the heart, and a significant proportion of them will need surgery. So we often look after patients recovering from complex surgery. Of course, this will depend on which part of world you live in. For example, in developing countries, you would probably see more of infection than post-operative patients.
Yeah, infections are definitely a huge thing. So, is there like a specific case that you remember related to infections that kind of, stands out to you? Maybe either because there was something that you learned from it, or just because there was something interesting going on.
Um, yes, I mean, we see children at different stages of infection. It's important that infections are identified early, and and the severity of the infection is identified early, and the child is referred to us as early as possible. That will help us to treat the child very early, in which case you would see a better recovery. Having said that, it's not always that straightforward. We do see very, very sick children with infection. Sometimes the infection is so severe We have to use very advanced life support machines like ECMO and so on. I can remember a child recently, maybe 2 months ago, where she developed fever and a reduced level of consciousness. She got to one of our sister hospitals, 150 kilometers from here. However, the patient had quick evaluation and was referred to us. Um, she was diagnosed with a condition called acute necrotizing encephalopathy, which is like a reaction to infection in the brain, which put her in the coma. When she came to us, she was in a state of locked-in syndrome because the inflamed critical areas of the brain called the brainstem. She was conscious, but she wasn't able to express herself because she was paralyzed, and the only response we could see her from her was eye movements. Because she came very early, we were able to treat her early with the guidance of the neurologist, which included immunosuppressive medications. And she made an excellent recovery. And when she came to us, she couldn't move any of her forelimbs. She couldn't talk. She couldn't express herself. By 2 weeks, she was able to walk, and by the third week, she was able to go home. She received life support for a few days. Usually, we expect these kind of patients to be on life support for a while, maybe a week or two, and the rehab to take many months. But because the condition was detected early and the right treatment was instituted very early, the recovery was excellent. So we work very closely with specialists in neurology, pulmonology, and so on and so forth to help us, take care of these children. Two things that we do in ICU is one is to provide life support. So if the patient has a life-threatening illness, life-threatening dysfunction of any of their organs, we support them. And the second is to dig deep and find a diagnosis and treat the underlying condition. The intensive care, the life support that we provide can only buy us more time. Unless we treat the underlying disease, and the critical care that we provide will be futile. So we often work with other specialists, for example, neurologists in this case, to guide us on what tests to do, and get to the diagnosis and treat the underlying condition.
That sounds actually really like interesting and also stressful because I know like, timing is everything in pediatric care, right? And especially since you work in the intensive care unit, it probably is like even more important. So, what advice would you like to give to parents? Because obviously they also play like an important role in the recovery of a child. So in like regards to acting fast and like noticing symptoms in the child, so what like advice do you have for parents?
It's a very difficult time for the parents, as you know, when their child is critically ill and there is a risk to life. And quite often we have to be honest with them, and we have to tell them that there is a possibility that their child might not recover. It's a very, very stressful time for the families. We tend to support them. We tend to involve them in the care of the child so that they don't feel helpless. So in our unit, parents are allowed to visit anytime, and one of the parents is actually allowed to stay with the child if they wish in the unit. We have facilities to for the one of the parents to stay with the child. We involve them in the care of the child. We involve them in all the decisions that we make about the care. So we provide our nurses provide support, and we talk to the family at least 2 or 3 times a day. We clear up any doubts in their minds. We reassure them about the care their child is receiving. So it's a very difficult time for the families, and sometimes this can have an impact on the parents for a long time many parents develop post-traumatic stress and other, have a significant psychological impact. So we try to minimize this by, providing as much support as possible. And for the parents, I would say, don't lose hope. Be involved with the healthcare team, and involve yourself in the care as much as possible. Take the guidance of the healthcare professionals and get involved in the care. Simple things to begin with, but once the child has come off the life support and so on, the role of the parents become more and more, especially for young children. Parents being available, when they're off the ventilator and so on is very important.
Okay, thank you for talking about that. So now we're going to move on to the next section. So in this, we want to talk about like the advances in pediatric critical care. So right now you were talking about like the technologies that you use, like mechanical ventilation and ECMO. So how would you say they've like transformed the way the way critically ill children are treated?
Well, both technology as well as the understanding of critical illness is growing. I wouldn't say we know everything, but there has been significant advances in many areas. This has had a big impact on the recovery of the children. For example, the mortality rate for many of these critical illnesses have come down quite significantly, especially in the developed countries. In the unit I worked in the UK, for example, most children, about 97-98% of the children who were admitted with critical illness, recovered and were discharged to the ward. Obviously, the recovery will be major impact on the recovery will be from the underlying disease. If the child had a underlying condition that cannot be treated fully, then it will have an impact on the recovery. However, the technology and the skills have made the prognosis much better for most of the children who come to ICU. For example, we have modern ventilators are much more advanced in in helping us provide mechanical ventilation in a safe manner, helping us prevent lung damage, for example. We have more monitoring tools which will help us reduce the damage that we do to the lungs with mechanical ventilator and so on. And we have much more advanced life support technologies such as ECMO, where we are even able to replace the function of heart and lung for some time. We routinely use, a dialysis type treatment for children who are in renal failure. So we're able to support the organs and the body to recover much better than before. These advances have made the prognosis better over time. These downside is sometimes, the children are left with significant morbidity afterwards, and the recovery and the rehabilitation takes much longer because many of these children who might have died in a previous era tend to make it, but because of the severity of the illness, they often have a prolonged recovery and rehabilitation.
Okay, thank you for talking about that. So as you know, technology is like evolving and like there's new treatments available every single day. So what are some of the latest technologies or treatments in pediatric critical care that you're like particularly excited about?
Well, and there are a lot of advances being made in many different areas. So we have, for example, we have ECMO, which has advanced a lot in terms of For example, the ECMO circuit, which we use now, is much more advanced. We are able to use ECMO without having to, anticoagulate or reduce the, suppress the coagulation system a lot because of the advances in the circuits. We have better, cannulas that we can insert into the patient. So all these things are advances little by little. And if you take, maybe a 10-year period, this all add up and make a significant difference for the patients.
Thank you so much for sharing your insights. So now we would like to move on to segment 3, which is on screen time concerns. So this is another topic that has been increasingly discussed among parents. Dr. Kesava, so what have you observed in your practice regarding excessive screen time among children?
Well, as you know, this is a big concern for not only doctors, but as a father, I'm significantly concerned about screen time also. I think it got worse during the COVID when children had to do schooling from home. It's been an important problem for the society in whole. I would say that I don't see anybody coming to ICU as a direct impact from the screen time, but however, it's very possible that they missed a critical medication, or they forgot to take the medication, and then they may end up in the hospital because they haven't had, they've forgotten to take medication and so on. In terms of what advice I would give the families, I think the parents have to take some control. For me, for example, I needed to educate myself about how I can have some restrictions and limitations, and in a reasonable manner, agree with the child that what the restrictions and limitations will be, and educate myself on the technology, because I had to buy some electronic gadgets to keep control. For example, no access after 9 p.m. So that was, a little bit. It takes time, and it's something that you're not used to. So you have to do it for the benefit of the child. And I think the school and the community is playing more and more role now. There is a big recognition from the school about the impact of this. So they are educating the children. And more recently, I find even children have apps which can help them monitor and limit the screen time. So all these things can have an impact. I suppose there is also a role for businesses at large and governments to also think about legislating against things that there must be some ethics in what the businesses try to do to capture your attention. So I think there may be a role for that, but as individual, as community, this is where the main impact should be. I think we have to be reasonable. I mean, more and more children are depending on gadgets for education and so on and so forth. But we need to have limitations, and we need to be strong enough to enforce them to some extent. Yes.
Yeah, totally agree with you on that. And we hear a lot about blue light affecting like sleep patterns in both adults and children, right? So are you seeing more like pediatric patients with sleep-related issues tied to having like a long like screen time? And like how does it kind of impact their overall health?
Yes, I can remember a child recently, 10-year-old young girl, who came with severe migraine It was so severe that she was suspected to have meningitis and was, referred to ICU for closer monitoring. Once the diagnosis was established, we were able to look at many different things, and one of the main reasons for her migraine to be precipitated was lack of sleep. And child was watching, has access to screen time, access to electronic gadgets, and even though the family believes and the parents believe that she's sleeping, she's not sleeping. So and when you're sleep deprived, this could trigger severe migraine episodes. Obviously, lifestyle is also affected. For example, you're not eating on time, your exercise becomes limited because you become passive, which could contribute to health issues. So yes, it can have a significant impact unless there is, there is some discipline brought into this. Yes. Yeah.
Yeah, for sure. And yeah, this has been like a leading concern in both parents and like healthcare professionals. So I think hopefully there are some like regulations and guidelines towards it. So also there's been like a lot of talk and about how screen time impacts children's like mental health, and like, their emotional like development. So from your perspective, what are some like long-term effects of excessive screen time on their like social skills and attention spans?
I personally feel that it's the using there's so much available in the internet. Obviously, whatever you take in through using the gadgets, watching different programs has an impact on your mind. And I can tell personally, I had to reflect on myself and had to cut down on, watching, very violent, uh, you know, uh, uh, kind of, content. It can have a significant impact on your mind. You may not realize it, but it may make you more worried about everything, make you worried about your safety. For example, I know of, a little girl who was quite worried about her safety, and because she's watching, some of the content which, tend to give her that feeling. So you have to really think about what you're watching and what you take in, and this will have an impact on your mind. And in the longer term, I feel it can make you, sad, and it can make you stressed if you're not careful about what you're watching. So you need to reflect on, what content you're watching and how you're taking those. Yes.
Yeah, totally. And to the kids that are watching us, maybe on, your Instagram For You page or your YouTube shorts, make sure we know you love your screens, whether it's playing games or watching your favorite shows, but remember, too much screen can be harmful for you. So after this episode, maybe take a break and stretch your legs and go outside and get some fresh air.
Okay, so moving on to the next segment, we're going to talk about pediatric cardiac care. So, this is a field where you've implemented some groundbreaking approaches. So, could you maybe discuss some of the most common cardiac conditions that you encounter in children, such as, and like also, like, we would love to hear about your innovative approaches, including like some of the techniques you use, like rational chest drain removal, and like how they've like transformed recovery for like children after cardiac surgery.
Yes. Of all the cardiac conditions, the congenital cardiac defects, a significant proportion of them, maybe 30-40%, need surgery very early on in life. And this is a major bulk of our work and care we provide to children in pediatric ICU. We want to help the children recover as quickly as possible. The one that I was talking about, the chest drains, it's not my, I'm not the first one to say this, but, I implemented that in our unit. The chest drains, are usually inserted at the time of surgery because there's always a risk of bleeding. And if there is bleeding, you want the blood to be drained out rather than, collect inside the body. And there is a very high risk of bleeding after cardiac surgery. However, it became almost like a routine practice to leave it in for maybe 2-3 days to be absolutely sure of if that they're not needed. However, the chest drain basically can cause discomfort and pain to the child. It can serve as a portal for infection because it's a plastic material in the body and so forth. So we, decided to implement a guideline which will guide the clinician to remove them at the earliest. One of the things is that we tend to assess the need for drain once a day. So if we decided not to remove it today, we will not look at it until the next day. So we said, okay, there's no reason to just evaluate the child for the need of chest drain once a day. So we can evaluate it 2 or 3 times a day. By that way, we will be able to remove the drain. And the second thing is the surgeon plays a major role in evaluation of whether a drain is needed. The decisions were always made when the surgeon was there. However, we got the surgeons to give us a clear criteria on when the drains can be removed so that he doesn't need to be there to make a decision. So many different things that we put together as a bundle to implement so that we can remove them at the earliest. Removing them at the earliest reduces pain. The child is, tends to recover quicker as a result. So you don't have to administer them pain medications. When you don't administer them pain medications, they don't feel nauseated. They're able to eat, or drink quicker, and so on and so forth. So things like this, can make a significant difference to the child. This is one of the interventions we introduced to help the child recover. Another intervention is to consider taking them off the ventilator. We used to routinely keep them on ventilator for a day or a couple of days just to be sure everything is okay. But now we know that the technology has advanced, the surgical techniques have improved, so we don't need to, follow that which we were doing 20 years ago now. Yes, yeah.
Yeah, thank you so much for that. That was super interesting. And as we wrap up today's discussion, Dr. Kesava, thank you so much for sharing your insights on pediatric critical care, and your expertise definitely sheds lights on like vital topics that resonate deeply with many parents and caregivers. So thank you so much again for that.
Thank you both for inviting me. It was a real pleasure talking to you both. All the best for your future career.
Okay, thank you, Dr. Kesava. Your dedication to improving child health is truly inspiring. And for our listeners, if you found this episode helpful, please share with friends and family. And don't forget to subscribe for more discussions with healthcare experts. Until next time, take care.